Welcome to episode 3 of our online series, Money Smart for Older Adults, brought to you by the Elder Financial Safety Center at the Senior Source. Hi, thank you so much for tuning in to week 3 of Money Smart for Older Adults. My name is Erica Sampson, and today I'm actually going to go over some state benefits that I actually help people apply for, how they can support your finances. I'm also going to go over the Ncoa screening tool, which is made available to you. I also want to make sure that y'all know that even though we are all working from home, we still can provide countless community resources upon request. So at the end, you will get our contact information, and anytime you're in need, please give us a call. I do have a lot to go over today, so let's jump right into it. So, what is the purpose of having state benefit programs? I like to tell my clients that state programs can actually help maintain or regain control of your financial health. And remember, you can utilize these programs either on a temporary basis or on a permanent basis, depending on your eligibility level. As we age, there are countless things that we all encounter, no matter what your age is. I think that a lot of us worry about our independence, being able to maintain our health, or if we do experience issues with our health, we wonder, can we actually afford the care that we need? Can we actually afford to go to the hospital? And then a number one concern, especially for people who are facing a time in their lives where it's time to retire, you also worry about, am I going to outlive my money? Do I have enough money to actually retire? There are some state programs that can actually help bridge the gap. Now, before we actually start talking about some of those programs that can bridge the gap, let's talk about ways that might actually prevent people from getting to those programs. Barriers and misconceptions. We all know that there are a lot of things that can prevent people from actually trying to get on assistance programs. Sometimes it can be just the fact that we just don't know what's out there. Or I've heard about the food stamp program, but I don't know how to apply. Or my neighbor told me that they went through all this time and effort, gave all this paperwork to the state, and then the state comes back and says, oh, I only got $16. There's a lot of things out there that can stop people from getting the help they need. So throughout this presentation, I want you to stop and just think about, has there been a time where maybe I needed help and I didn't ask for help? Or what are some other things that people are experiencing that may prevent them from getting help? During my normal presentations in person, I would do what's called a breaking down barriers activity. This is when I open it to the floor to everybody to just kind of talk amongst themselves and just say, okay, here's what I've experienced, or here are some other things, and here's a little information about some of the things that they've said. A lot of times people don't want to go through the trouble. It can be difficult to get all the paperwork, or let's say you actually tried to get help before and then the state didn't make you feel good. Like maybe you had a bad experience with a representative and it just made you feel like, I just don't want to do this anymore. A lot of times, sometimes people want to apply for benefits because they say, it's just me at home. I don't have any children. I don't want to take money from a pot of funds that can actually go to somebody else that I feel needs it more than me. Or sometimes, it can just be difficult asking for help because you don't want to feel like you're a charity case. I just want us to stop and think about all the different things that can prevent people from getting help and what can we do as a community to stop that. Please do not let fear or lack of knowledge or even the opinions of others be the reason why you do not try to get benefits that can be extremely helpful for you. At the end of the day, it is our right to apply for state benefits. Our pledge to the community to help overcome some of these barriers is to provide benefit specialists to the community at no cost to help you navigate your situation, see how we can help you in your budget, and just seeing what benefits might be able to help, please don't hesitate to give us a call and let us do the work for you. We provide side-by-side benefit application assistance. We can also provide benefits navigation. So let's say you have an active benefit like Medicaid or the food stamp program, but you're experiencing some issues. You can still give us a call and we will help you as best as we can, even if we have to call the state with you on the phone and just kind of help you talk to them. We provide care coordination as well. At the end of the day, it is always your right to apply for these benefits. Now, that does not guarantee that if we help you with these benefits, you will be approved. But I always like to say it's better to apply for benefits and be denied than not apply for benefits and may have gone a long period of time struggling financially when these benefits could have helped you. As you can see on this slide on the left, I have some photos of my family members. In the top, it's my family with my aunt. In the middle, it's my family again with one of my grandmothers. And at the bottom, you'll see my brother, me, with my grandfather and my grandmother and my cousin. I like to show these pictures because one thing that I love about my position as a benefit specialist is not only has it helped me learn about my future and how I want my retirement to look, it's helped me make better financial decisions for myself now. It has also helped me be able to take all of this knowledge to my parents and my grandparents and the elders in my family and just get them better equipped or even help them navigate their own financial situations and their own medical health. At the Senior Source, we are very passionate about seniors. We are passionate about helping those in need. So please know that when you do call us, you will be treated like family. Now, today I'm going to briefly go over the Ncoa screening tool, the SNAP program, formerly known as the food stamp program, the Extra Help program, as well as the Medicare savings program. The Supplemental Nutritional Assistance Program, or SNAP, is the program that was formerly known as the food stamp program. If you get approved for this program, you can expect to receive a debit card in the mail, along with an award letter that will tell you how much the state has awarded you on a monthly basis. It is also good to notate how long you will be receiving this benefit and on what date each month you should expect to receive it. Generally, the food stamp card can be utilized at most local grocery stores and some farmers markets. If you would like to make a note, there is an app that you can download on your phone called Fresh EBT. That is FRESHEBT. If you download this app, it will actually tell you where all, based on where you currently live, you can actually take that card and utilize those benefits. The great thing about that app as well is it will keep a running total of how much you have on that card. Here are the SNAP income eligibility limits for 2020. As you can see, the more people in a household, the higher the income limit becomes. That is the same for the maximum SNAP benefit. The more people in a household, the higher the max monthly benefit can possibly be. Now, to further explain, these numbers do not mean that this is the amount that you will get. This is just letting you know this is the maximum you can possibly get. Now, the minimum as of 2020 is $16. So that basically means if I apply for food stamps as a one-person household, my benefit amount can range anywhere between $16 and $194. Now, before we move to the next bulletin, I just want to let you know about some information that was put out from Health and Human Services a couple of weeks ago. For people who are currently enrolled in the food stamp program, please expect the maximum amount for both April and May. So what does this mean? If you currently have the food stamp benefit, but you were only awarded $16 a month, you should have seen an increase in your monthly benefits for the month of April. This is in response to the COVID-19 pandemic. They have approved a temporary increase in benefits for the month of April and May. Generally, everybody should see their increased benefit amount by the 15th of each month. If you do have any other questions or are experiencing any issues, you can call 211 and speak with Health and Human Services, or you can give us a call and we can help you as best as we can. Now, the Medicare Savings Program is another program offered by the state that utilizes Medicaid funding to help provide assistance for Medicare premiums and some out-of-pocket costs. Now, I know when you first look at this slide, it can be very confusing. There is a lot of information, but one thing I want to point out is you will see that there are 3 levels of the Medicare Savings Program. Each level will cover the Part B premium that is traditionally deducted from your Social Security every month. This year, the Part B premium is $144.60. If you get approved for any level of Medicare savings, the state will no longer charge you this amount. If you get approved for the Q and B level, the state will also provide additional assistance by covering the 20% that Medicare traditionally does not cover. This basically means they will cover not only just the Part B premium, but co-insurance and co-payments and other deductibles. If you want more information, just give us a call. Now, the last benefit program I'm going to discuss today is the Extra Help for Prescription Drug Program. This program is actually administered by Social Security Administration and is actually really easy to apply for online. Now, I do want to point out, if you do get approved for the Medicare Savings Program, the Extra Help benefit is built into that program, so you do not have to apply for it separately. Now, what can this program do for you? Extra Help is a program that will provide lower costs for prescription drugs. A lot of times when my clients get approved for this program, they no longer have to pay for their Part D premiums. They no longer, in some cases, pay for some medication. More often than not, they'll actually see their costs or their co-payments for their medication or prescriptions go down anywhere between as low as $3. I've had some clients tell me that they pay $1 or $2 for generics, and then for name brands, they've seen drops as low as to $5 per name brand, ranging all the way up to $8. Please take note of the income limits for this particular program. Now, I know I just gave out a lot of information, and I don't know about y'all, but I'm actually a very visual person. So here is a visual example of how benefits can look before and after when applied to a household budget. So this is actually an example of a family member that I helped apply for benefits, and what we did was we did a budget before based on what they were going through and how their financial health was before, and then we created an additional budget after they were approved and the benefits kicked in. So as you can see, this particular person went from a deficit of $570 if they paid for everything on time, got all their medication, all their food, to now their budget afterwards, they're actually in the green, almost $76. One of their goals was to start saving again, which I know is something that stops whenever our financial health changes drastically, which for some people can be retirement. I think this is a really good depiction of how crucial benefits can really be and how they can really save a household budget. Last but not least, the Ncoa screening tool. This amazing tool actually gives us the capability to enter in all of your personal information as well as your demographics and create a document specifically for you based on your need. This document will actually have a list of all the available resources and programs in your community. We can generally help you apply for the bulk of these benefits. However, it does give you their contact information and more information on how to apply for any of these programs. So if you're interested in having benefit screening done for you, please give us a call. If you would like to know more information about benefits, please give the Elder Financial Safety Center a call at 214-823-5700 and choose option 1, or feel free to send us an email at efsc@theseniorsource.org. Thank you for your time. Have a great day.